Our emergency rooms are seeing a big decrease right now in visitors during the pandemic. SSM St. Mary's says that our area has seen a decline of 33% from April to June.
Doctors think some people might be hesitant to get the help they need because of the coronavirus, but it's important to note there are safety measures in place. Dr. Kyle Martin is joining us this morning to talk about them. Good morning, doctor.
Good morning. Thanks for having me.
Yeah, thanks for joining us so early. Let's start by breaking down why this is an issue, why this decrease in folks coming into the ER could be problematic for health.
Well, one of the things we've observed is that we have folks that I think if they'd come in earlier with their stroke or their heart attack, we really could have made a bigger difference intervening earlier on. An easy example of that, we're seeing more cases of appendicitis where the appendix is actually ruptured. And so if they'd come in earlier in the course, we could have gotten them to the operating room more quickly and potentially have prevented that rupture and the other serious things that happen from that. So it's really important that folks know that you don't want to delay going to the ER or calling your primary doctor for anything that would worry you.
Well, Dr. Martin, do you think that the decline has anything to do with people who have lost their jobs and have lost their health care insurance, about it just being too expensive to visit the ER?
That certainly could be a component of things. I think that we're seeing a decline for a number of reasons. That could be part of it. Folks are a little less active this year than they have in past years, so we're seeing less trauma, less accidents. And I think that people appropriately are avoiding the ER still in order to make sure they're keeping everyone safe and they're not potentially coming in with coronavirus symptoms too, if they could follow up with their primary doctor or go to urgent care.
So what are some of the...
It's probably multifactorial.
Sure. So what are some of the safety protocols you folks have put in place to keep people safe during this pandemic?
You bet. It really starts at the beginning. As you're walking into the ER, we have a screener immediately, and you can't get past that point. At that point, we ask typical screening questions for symptoms that might be related to coronavirus. And if there are any, then they're brought immediately back to negative pressure rooms or this negative pressure wing that I'm in now. We also have a separate area for patients with non-COVID related symptoms that we see in a more typical kind of ER. Along with that, actually, I've got my friend Jim here is able to model. This is our typical PPE. We have plenty of PPE now. Obviously, earlier on, we were worried that we may be running out, but we've got good supplies right now. And so when we go in the room, we've got the mask and a face shield, goggles. Then we also have the gown and then gloves. And then this entire hallway is a negative pressure room. So what that means is that it's just basically a really strong vacuum, and it's pulling out any of those aerosolized particles are being pulled out immediately. So this whole hallway that we have is set up separately for potential coronavirus patients. And then on top of that, each room has additional negative pressure in addition to the hallway, which is also further pulling any of those particles, any of those viruses out, so that's not in the general circulating air. And that's one of the big things we see with bars.
Okay, that is good to hear. Thank you for your time this morning, Dr. Martin.
You bet. Thanks for having me.
Good to see you.